You who don't know me or haven't seen me around, my name's Candace. I work in the OR with Dr. Lugo. I scrub all his cases. One of the nurses back there. So today we're just going to go over a couple different things. One of the things has to do with preventing infections and our HIPAA baths that we do. Recently the OR is looking into some different protocols that we do. But they wanted to stress to make sure that we are doing our HIPAA bath the night before surgery and the morning of surgery. And I don't know if everyone's aware or not, we do another HIPAA bath in the OR for every patient. It's not necessarily considered sterile, but we do wear sterile gloves, and then that's all dried off before we chlor prep the patient. So luckily, we have not had a lot of infections compared to some of the other areas, so they're going to try to move across the whole OR and using the HIPAA bath in the OR as well. One of the reasons why we do that is because, for instance, if we get an emergency, they may not have, showered before we get them, so we always clean from head to toes. One of the other things that's really important to help prevent infections is clipping. Now the 8th floor, hands up, I was told to give a big shout out that you guys have been doing a great job. We've had, every once in a while we have to do, a little spot check here or there, or if the patient does come from the ER, we've gotten dinged, but at AAA, we're not going to have time to clip them before they get to the OR, so they're going to end up having to get clipped. One of the main things, I know we have this little diagram body. I'm going to use this as itty bitty. But it's just making sure, even if we know Dr. Lugo is primarily going into the chest, he could be having to put in a balloon in the patient's groin. Even if we're just doing an aortic valve, we always still have to have our legs clipped down and ready to go, and the chance that we would have to emergently take a piece of vein. One of the other areas that Dr. Lugo puts cannulas a lot, like on aortic dissections and stuff, is up in this axillary area. So we have to make sure that when we're clipping the patient that we're going wide out through those nipples. Not necessarily, we don't want the underarm pits, you don't have to do that, but if you have someone who's really hairy, making sure we're getting the prep wide, covering down where his chest tubes go, so we don't want to leave a hairy abdomen, and make sure we get those groins well, and then the inside of the leg is where we're going to be taking that vein from. So if you guys can help us out with that, we would appreciate it. This is our emergency heart cart that's stored over here in the ICU. There is a sheet on it that lists everything that's inside of it. ICU does a good job of keeping track of any outdated items, but all the supplies in here come from the OR. So for any reason, Dr. Lugo's like, I need a chest tube, I need femoral line, you guys can break there's usually a tab on here, you can break it. The only thing that we ask is that you keep track of what you opened for him. This will then get sent over to purchasing and billed to that particular patient. The OR also at that time will be notified. You can notify myself, Matt, Mary Beth, and we will restock the cart with supplies from the OR. But we can't just have someone go to the OR and get the supplies, because then that messes up the whole hospital's inventory system. One of the things that's important to do is to know how to put a saw together. So we're going to do that in a little bit. Hopefully you never have to do that, but during the day hours we're always here, but in the evening there's a chance that we might not be here and Dr. Lugo might beat us to the hospital. So in this emergency heart cart, in the top section we try to organize it and label it the best we could. There's a lot of suture, femoral line supplies. There's two different femoral lines, a short one and a deeper one, depending on the patient. He'll tell you which one he wants. His gown, gloves, extra towels are in here, as well as sponges, chest tubes, sternal wires. You guys, I don't expect you to memorize and know where everything is. Really just, if we ask for something before the rest of the OR team, we try to label it with the main items we would need. This is your number one drawer that you want to open first. This bottom one. And we try to make it as easy as we could. Open first. And there should be 5 items in here. They're usually rubber band together. I think they use some of this stuff today.
Rubber band.
Yeah. So what we want to find in here is suction tubing, a Yankar tip, wire cutter, so if the patient was just done in the OR, he can cut through those wires. You don't really get a pickup. And a spreader, so he can spread open that chest. And a knife. So there's 5 things. So he's going to grab his gown, gloves, he's self-sufficient, he can do that. And then you guys just have this pack ready to go. One of the new things is we're not worried about putting betadine, pouring betadine over the chest, even though I would like to do that.
It's a big step for you.
It's a big step, I know. So he'll just take this knife, cutters, pull open the chest, put the spreader in, get that suction in, especially if it's tamponade. From there, hopefully we've arrived by that time. If not, the second thing, if you guys can pull a little side table in, these are all the instruments. If you just open this blue pack onto a table for him, he can pilfer through and find what he needs.
Did you say anything about anyone else gowning and gloving while we're waiting for you?
Go over with her picture about where you want us before anybody arrives.
So we have, where did I put it now? Denise already lost it. She made this little diagram thing.
Oh, good.
I want her to sign it after.
Of where everyone would be. If Dr. Lugo's scrubbing in, a lot of times I know you guys have a step around, especially if you're doing CPR or whatnot, or he's getting into that chest. We need to assign someone to grab different things. So I would say one person needs to be in charge of getting this emergency cart to the room. The same person who brings the emergency cart, this cart to the room, should be the person that I would think opens these first 5 items.
Okay, so
Can I just say that what you were saying, the first things to open, no offense to anyone, but they may say, oh, Candace said those are the first things to get, and they just sort of hand them to me. No, you got to open those on a side table.
Yeah, like
Well, I'm gowning and gloving, start opening
stuff. You can't just give this to him like
just
a
don't
package.
hand it to me.
Like you just rip it open. And even though we care about sterility in the OR, this is emergency. Someone's dying. If I quite honestly, if this fell, he's still gonna like use it. So. So that's what we talked about, having the little side table to put this on too. Like if you get the side table and if you had time, you could open this and then open all that into that spot. But,
so we should open before you walk in the door.
That would be in the best of all. If I say I'm opening up, then maybe you should have everything open, because I can tell you it may take you a while after I'm there.
Right.
Yeah.
and I mean, I can even put a big sign on here that just says, this is Dr. Lugo's. So you can already have his gown open with his gloves sitting there for him to put on.
Gotcha.
Now, other things that are on here, these 18S bags are in addition, but there's internal paddles right here. So, and there's a lot of times when Dr. Lugo would ask for paddles, or there's also pacing cables in case one of our pacing cables gets cut, or we have to put a new pacing wire in. And that's what I feel like suture-wise is one of the things that you've asked before that's been confusing. So these are like his pacing wires, and then down here are these disposable cables.
2 different things, because the one time I did ask for new cables, and everyone said, "What are the people in the?" It was the middle of the night, and they were like trying to hand me, "Oh, are these your cables?" No, those are the cables.
And everybody should be familiar because we went like universal to these disposable pacing cables. So you should be seeing these patients come out of the OR with this set on, coming to the ICU, and then going up onto the floor as well. But we always keep backup because they could get cut when we're pulling that chest open. So if you have a patient that had surgery recently and it was minimally invasive aortic valve, minimally invasive mitral valve, Anything else?
Any of the minis.
Any of the mini stuff. You've probably seen this. It's usually covered in this clear plastic bag, and this is our emergency sternotomy CVICU. And this follows the patient once they leave the OR to the ICU, up to the floor, wherever they go. If they had to go to X-ray or something like that, this saw should never leave their side until they're leaving to go home. The reason for that is because if this patient had a mini mitral or a mini AVR, their entire chest is not cracked open. So if Lugo has to emergently get in there, tamponade, whatever reason's going on, he is going to need a saw. So inside of here,
Johnny was getting excited. He saw power tools.
I bought a new set today.
so first off, on the outside of this, Miss Page puts a sign that says, like, keep this with the patient. So you should see a sign on it, so you should know, hey, I'm taking the patient someplace, I need to take this with them. Inside of here, too, is a little sheet that tells you exactly what supplies should be in here. First thing, knife blade. So that's what you would hand open to him first if you were standing there. And then,
So he can cut the skin.
so he can cut the skin, and then here's the saw. The battery and the saw come separate, and the blade for the saw. So you're gonna be like nervous the first time you do this. It's like emergency. It's not the easiest thing to do. That's why we pass around the room and have everybody practice. But before you ever put that battery on, I know you'll get excited because this is a power tool, but you should always put the blade in without power attached to it. It's, the blade goes downward, so think of Dr. Lugo using the saw. He goes in a downward motion down the chest. It can be used the other way, but so you want the jagged edges down.
Pointing towards the grip.
Yeah, towards the grip, I guess. So this twist, and then this is going to pop in. You'll hear it kind of click, and you'll know once it goes back, this isn't coming out, it isn't going anywhere. If it does not click in, which I've done before, and he goes to fire this, it will shoot across the room, and then it's not any good. There is a safety guard that goes on top of it. This is so that when he's using it, he just doesn't stick it all the way down deep into the patient's heart. This is also another twist maneuver. Slides in, and you'll hear it pop. That tip of that blade sits inside of there, so it's not wiggling all around. Now, you can put on your battery. You just rip this blue wrapper open, because yet again, we're in an emergency situation. We're not all worried about sterility. It's going to slide onto the back end, snap. Safety is lined up in the middle. You can push it to the right, you can push it to the left. He likes it on the fastest speed, but he's going to use it whichever way you give it to him. So you'll want to test it before you hand it to him. That's working. Okay. So that's that. After he saws through the chest, there is a little baby retractor in here as well. They can put in. Now, if the patient just had a mini sternotomy AVR, there may be a few wires in there. So before he uses the saw, there is a wire cutter in case he has to snip something, and there is some clamps in case he has to grab onto wires or get them out of the way.